Do you have patients who are tired of waking up early in the morning to take their medication for chronic immune thrombocytopenia or chronic ITP? Are they ready for a treatment that doesn't involve added visits to and from your office for frequent injections for administration? Do you know if they're tired of watching their calcium intake day after day? Well, we may have a solution for you. Let's talk about DOPTELET, a treatment for thrombocytopenia in adult patients with chronic ITP when other treatments just haven't worked well enough.
Yes. Thanks for tuning in. My name is Barry, and today I'm here to tell you about DOPTELET. It's the only oral thrombopoietin receptor agonist, also known as TPO-RA, that your patients can take anytime, anywhere, with any food. That's right, everybody. Now, maybe you already know a little about DOPTELET, including that you should monitor patients and adjust the dose based on their platelet counts and other treatments that they're taking. But there's so much more to share. You guys want to hear it, everybody, right? Yes. So today, I'll be accompanied by my co-host, Stephanie, a nurse practitioner who works with chronic ITP patients. Who wants to see their nurse practitioner?
I want to see my nurse practitioner.
Yeah, so let's bring on out Stephanie. Come on out. Yes. Okay, before we get into all the details, Stephanie, tell me about yourself.
Well, I'm a nurse practitioner.
I want to see my nurse practitioner.
If you're looking for a treatment for your patients that they can take on their own consistent schedule, then keep watching to learn more about DOPTELET dosing.
One of the first things we want to discuss is how your patients take their medications. So, Stephanie, I heard that patients could start DOPTELET at 20 milligrams once a day with food. Before we get into all the different dose adjustments, whether it's based on platelet counts or other medications patients might be taking, can you tell me more about the with food part of that dosing recommendation? I mean, what kinds of foods exactly can patients eat while they're taking their medicine?
Well, some patients might wonder if they'll have to limit the types of foods they eat while they're taking their medication. But DOPTELET is the only oral TPO-RA patients can take with any food. Really, any food patients like is okay with DOPTELET.
How about that, everybody? That's amazing! Any food you want. It's so nice to hear. I've also heard that some patients need to manage food type restrictions on certain ingredients like calcium. You may not even realize how much calcium there can be in something like half and half in your coffee. And I know some patients struggle with planning meals around their pills because they have to wait a certain amount of time after snacks and meals.
Not so with DOPTELET.
Not so with DOPTELET. Say it with me now.
Not so with DOPTELET.
Now that we know that DOPTELET can be taken with any kind of food, I'm hungry. Let's head over to the kitchen. When I say dot, you say tell it. Dot, dot, dot. Yeah, that's right. Great job, everybody. Now, I remember hearing you say earlier that you could take DOPTELET anytime, anywhere, with any food. But does that mean that they can take DOPTELET with a scoop of ice cream?
Yes.
Who wants ice cream? Let me ask this. I'm having a light meal. It's just a winter squash. Can I take DOPTELET with that?
Yep.
Ooh, love a winter squash. I'm in Italy, and I sit down for a fancy meal, and all I can think of is to order pizza. Can I take DOPTELET with that?
Of course.
Oh, amazing. I'm gonna eat one of these cheesy poofs. Actually, a lot of cheesy poofs. Can I take DOPTELET with that?
Absolutely.
Perfect for DOPTELET. This has been great. I've heard that you can take it anytime, anywhere, with any food. And look at all the foods and choices you guys have. How about a round of applause?
And I should remind the audience that patients don't have to take DOPTELET in a doctor's office. DOPTELET is an oral pill that can be taken anytime, anywhere, without adding trips to the doctor for administration.
So you're telling me patients don't have to come back to the doctor's office to take their dose of DOPTELET?
That's right. Patients will still need to come into the office for platelet monitoring so doctors can see if a dose adjustment needs to be made based on platelet response or drug interactions. But no added trips to the doctor for administration.
So patients can take DOPTELET however they want.
Well, it's a medicine, so they have to take it according to their doctor's prescription, which involves taking each dose on a consistent schedule with food. And it's important to remember that while DOPTELET has no food restrictions, it doesn't mean patients shouldn't follow a healthy, balanced diet.
Right. Duh. Do you want something?
I'm good.
You're lost. All of these foods are calcium-rich and can find themselves on your patient's shopping list.
Yep. Do we have time for dosing?
Yeah!
As we mentioned earlier, the recommended starting dose for DOPTELET is 20 milligrams once daily with food. However, you may need to make dose adjustments based on platelet response and for your patients who are taking moderate or strong dual inducers or inhibitors of CYP2C9 and CYP3A4. One goal of chronic ITP treatments like DOPTELET is to increase and maintain platelet counts. After starting your patient on DOPTELET, you should assess platelet counts weekly until you achieve a platelet count of 50,000 microliters or higher. Then continue to monitor platelets monthly thereafter.
So, what happens if you have a patient who's not at the 50,000 goal?
Well, there's an established titration schedule based on the patient's platelet counts. If your patient is below their treatment goal, you can titrate up. And if a patient is above their treatment goal, you can titrate down. DOPTELET also does not require any additional liver function monitoring, as no significant hepatotoxicity was seen in the DOPTELET clinical trials. Again, platelet monitoring is required, but remember, the doctor will still monitor platelet counts at baseline, during treatment, and at least for 4 weeks after discontinuation.
Thank you, Stephanie, for telling us all about how DOPTELET can be taken anytime, anywhere, and with any food. Stay tuned, folks, because you don't want to miss our important safety information.
DOPTELET, avatrombopag, is indicated for treatment of thrombocytopenia in adult patients with chronic immune thrombocytopenia who have had an insufficient response to a previous treatment. Important safety information. Warnings and precautions. Thrombotic, thromboembolic complications. DOPTELET is a thrombopoietin, or TPO receptor agonist, and TPO receptor agonists have been associated with thrombotic complications in 0.4% of DOPTELET-treated patients with chronic liver disease and thromboembolic complications in 7% of DOPTELET-treated patients with chronic immune thrombocytopenia. Portal vein thrombosis has been reported in patients with chronic liver disease, and arterial and venous thromboembolic events have been reported in patients with chronic immune thrombocytopenia that were treated with TPO receptor agonists. Consider the potential increased thrombotic risk when administering DOPTELET to patients with known risk factors for thromboembolism, including genetic prothrombotic conditions. DOPTELET should not be administered to patients with chronic liver disease or chronic immune thrombocytopenia in an attempt to normalize platelet counts. Monitor platelet counts and for signs and symptoms of thromboembolic events and institute treatment promptly. Serious adverse reactions. The incidence of serious adverse reactions was 9% in the DOPTELET-treated group versus 5% in the placebo-treated group. Serious adverse reactions reported in more than one individual DOPTELET-treated patient included headache, occurring in 1.6%. Adverse reactions. The most common adverse reactions occurring in greater than or equal to 10% of patients with chronic immune thrombocytopenia were headache, fatigue, contusion, epistaxis, upper respiratory tract infection, arthralgia, gingival bleeding, petechiae, and nasopharyngitis. Post-marketing experience. Following the approval of DOPTELET, hypersensitivity reactions involving the immune system, including but not limited to pruritus, rash, choking sensation, swollen face, and swollen tongue have been reported. These are not all the possible risks associated with DOPTELET. Please see full prescribing information for DOPTELET at www.doptelethcp.com. To report suspected adverse reactions, contact SOBI North America at 1-866-773-5274 or FDA at 1-800-FDA-1088.